All right, we all know this person. We've all had him in our practice before. It's the, I have the best insurance on earth and they're going to cover everything. Don't worry about it. Or I want them to cover everything. They better cover everything. And then when you go and do a courtesy benefits check, they've got a $10,000 deductible. They have 4 visits that they're allowed to use. And again, you just bill my insurance, they'll cover it. You know, it's funny, I had breakfast with an OB-GYN this morning. Super, super nice lady. And very, very knowledgeable and kind doctor. And we got to talking about insurance with patients and how patients have no idea of how insurance works, what their deductible is, what a deductible is, how many visits that they get, is it qualified, is it allowable, you know, what's an allowable, like there's so many nuances to insurance and patients truly have no idea. But here's what they know they want. They want care. They want minimal responsibility. Now you'll find those people, there are people out there that understand that it's their responsibility to take care of them. We're only talking about this one certain level of patient. And they expect everything. Well, that's just not how the world works. They just don't know. Now, I don't know who's to blame for that, but you know, in all reality, you can only be as transparent as you want. So the question I was asked to answer is, what do we do with them? How do we answer them? How do we respond? And in some ways, I don't really know. You can talk to these people till they're blue in the face. And there are some that I've actually called the insurance company while we're back in the consultation room and played dumb and said, well, tell me what a deductible is. Tell me what this is. So the patient has to cover $5,000 before any benefit is given. Is that right? So doing this on speakerphone in front of the patient with an insurance rep sometimes is the only way to get it done. But even then, they still don't believe it. And then when you say they're not going to cover anything, you just heard Sarah tell you over the phone, like there's no coverage. You have no coverage. And then they get frustrated. And rightly so. I would be frustrated too, because people pay thousands of dollars and who knows what the monthly cost is that comes out of paychecks or paid directly, and they're not getting any benefit from it. And that's got to hit home really quick and really, really fast. I don't know if there's a direct answer or a right answer to this, but sometimes you just have to if it's unrealized expectations, sometimes you just have to say, that's the way it is. Do you want the care? Do you want the results that you're looking for? This is what it costs to get results. And if you say it with confidence and say it with proper authority, I mean, there are winnable cases this way. But most of the time they're not. They're not. Just because your expectation and their expectation, they never match. Listen, I hope this helps. I hope it gives you some clarity or at least some idea of working with, I want my insurance to cover everything patients, because, well, it's a tough cookie to crack. So, all right. I'll see you on the next one.